Senator Vance. I just have maybe one or two more. Dr. Abir, we know that older adults and people with disabilities suffered the most from the COVID-19 pandemic. That's so plain from the numbers. As I said before, just older adults ages 65 and over were 75% of the deaths. The vast majority of deaths and serious illnesses from COVID-19 occurred among those two groups of Americans, both seniors and people with disabilities. We also know that in the context of a particular setting, congregate settings were often the place where people with disabilities and older adults contracted the virus. We know as well that home care is an alternative to congregate care, and older adults and people with disabilities who receive support at home often had better outcomes during the pandemic than those in congregate settings. Unfortunately, we have a crisis in home care services in our country. Would you consider the development of a more substantial home care workforce and a network part of both the preparation that's needed here as well as the mitigation for circumstances we're facing a pandemic?
Absolutely. So I think that would be important for preparedness, response, and recovery. And the best thing about this idea is that it's relevant for routine care and routine circumstances, as well as in the setting of emergencies. So if a person is able to get discharged from the hospital sooner because they have a home to go to and there's home care available and scheduled and planned so that the person can go home, a nurse can visit, give them their medications, check in on them, make sure they're eating, or whatever else it may be, that means that that person is spending fewer days in the hospital, occurring lower costs for a hospitalization, likely not picking up a hospital-acquired infection or other complication in the hospital. So I think it's a win-win for everyone. And the current system of let's wait for everyone to get sick enough to go to the emergency department and get hospitalized is not sustainable. And the population, again, is aging. So we need to get creative about our solutions, and the home care and hospital at home solution is really something that I think should be at the forefront of strategies that we consider.
Well, thank you. And I think that's among the many. We've learned so many lessons from the pandemic. That's certainly one of them. Maybe just one more question for you, Dr. Abir. You've been doing this work for a long time, and you've done it both from the point of view of a researcher as well as a physician. You've carefully studied the response to public health emergencies all the way from COVID-19 to Puerto Rico after the devastating hurricanes. We're told that since Katrina, the federal government has made a concerted effort to include the needs of people with disabilities and older adults in this emergency planning and recovery processes. Can you share with us some of the improvements you've seen? We're obviously focused on shortcomings and areas where we need to improve, but any improvements or progress you've seen over the past decade when it comes to meeting the needs of those two groups of Americans?
So yes, I think that there has been some progress, although it is a byproduct of thinking about and planning for other populations, not necessarily older adults or people with disabilities. I'll give you an example. So one thing that was, for the longest time, not part of preparedness plans and response plans was planning for people with chronic kidney disease. So people who require hemodialysis, which, as I'm sure you know, is critical for a person. So if they miss enough days of hemodialysis, it is fatal. So planning for hemodialysis for individuals and where they're going to get it if they're displaced or unable to go to their center because they just can't get to the place because of a tornado or hurricane, there are plans developed around that, and a vast majority of folks on dialysis are older adults. So that planning has been critical. Another example is that Many emergency departments, I shouldn't say many, some emergency departments in the United States are now certified to specifically take care of older adults. And that just signals to you that how important and different it is, that there are certain needs, even during routine care, that we need to really consider differently and develop kind of practices around this particular population. So yes, I think we've made some advancement, and there's other examples, but I think that we really have kind of not explicitly focused on these populations, and we have not done it in a data-driven way. And I think that the best opportunity now is the hindsight of looking at the pandemic, because it did affect these populations the most, and we now, unfortunately, have plenty of data to look back at.
Well, thanks very much. And I know that we have to conclude, so I want to move to my closing statement before I turn to Ranking Member Braun. But I do want to start by thanking our witnesses for bringing, in each case, a combination of expertise, experience, your personal experience, and your own perspective to these issues, because we have a couple of opportunities. The pandemic, all hazards reauthorization is one of those moments where we can focus on making sure that people with disabilities and older adults are part of the planning and response. But we have to look for other pathways as well. And as we heard today, emergency preparation can only be truly inclusive when all stakeholders are invited to the table and are committed to meeting the needs of all groups of Americans. We heard from Annie Lloyd about the importance of accessible and accurate information, how frightening it can be to not have up-to-the-date accessible information, especially in her case, worrying about her son and her family. This is why it's so important that emergency planning explicitly protects the health, the safety, and the independence of older adults and people with disabilities. The legislation that I've introduced, the Ready for Disasters Act, will ensure the voices of these individuals are included throughout every phase of emergency preparation. I'll continue to work with my Senate colleagues on the committee and in the Senate to make sure that the Ready for Disasters Act is included in the reauthorization of the Pandemic All Hazards Preparation Act. Together we can protect the health, safety, and independence of older adults and people with disabilities and help communities prepare and respond to disasters and emergencies in a truly inclusive manner. Turn next to Ranking Member Braun.